Next is the safety and efficacy of subliminal cyclophotocoagulation in the treatment of glaucoma. The presenting delegate Dr. Priyanka Ramanathan.
Good afternoon and all. I'm Dr. Priyanka. I'll be presenting on safety and efficacy of subliminal cyclophotocoagulation in patients with glaucoma. Subliminal cyclophotocoagulation is one of the latest technology that uses 810 nanometer diode laser, which is non-destructive. It consists of series of highly brief microsecond pulses on the targeted tissue with a minimal collateral damage. It helps in reducing the drug burden for the patient and evidently improves the quality of life. It also has an added advantage of easy application with improved and focused energy delivery and reproducibility of the outcome. So based on the pulse technology, there's something called as duty cycle, which provides cool-off period between the pulses. So during the on time, the laser will be acting on the targeted tissue, but in cool-off period, it allows the tissue to cool, so there will be reduced collateral damage. So it eventually eliminates the risk of overheating. So it reduces the collateral damage and minimizes complication, and there is no direct impact on the vision. So in this procedure, we use certain parameters with a fixed duty cycle at 31.3% with a treatment duration of 160 seconds. Superiorly, we use 80 seconds, and inferior quadrant we use 80 seconds with a power of 2000 milliwatts. This is the parameters that is shown in the device. So the tip of the probe is positioned at 3 mm posterior to the limbus and perpendicular to the eyeball. So the probe tip moves continuously in a sliding motion, so superior and inferiorly, avoiding the 3 and 9 o'clock position to prevent the damage to the ciliary nerve block while delivering the laser treatment. So in our study, we took 27 patients with various indications of glaucoma, most common being the primary open angle glaucoma, followed by angle closure and ocular hypertension. So median pre-op IOP was 22, and with the average number of medication was 3. With most of the patients had poor visual acuity. Some patients, only 3 patients who had poor visual acuity, 2 is because of the cataract and 1 is because of the traumatic aphakia. These patients underwent a subliminal cyclophotocoagulation. Post-operatively, patient was followed up for 6 months, and complications were noted at each follow-up visit. So this first graph shows the trend of IOP reduction post-operatively over the time compared to the pre-op. So the study result shows that IOP reduction was noted significantly at each time point. And the second graph shows the trend of reduction of anti-glaucoma medication comparing the post-op and the pre-op. So the dip in the graph corresponds to the maintenance of the IOP during this time. When the anti-glaucoma medications were further lowered, it causes the rise in IOP, which is seen in the first graph. So eventually the laser reduced at least one topical anti-glaucoma medication in 61.5% of the patient at 6 months compared to from the baseline. So these are the various complications that were noted in our study, most common being the anti-tumor reaction and the mydriasis, but both were transient and spontaneously resolved over the time. So these 3 complications that were dreaded and which was observed in the study, we will see one by one. The first complication, which is vitritis, was noted in one of the patients who had diminution of vision, sudden onset at 1 week follow-up visit. Fundus examination showed grade 4 vitritis, which is confirmed by B scan. It was managed medically with oral and topical steroids, and she regained 6/6 vision in 1 month. The second complication, patient developed a hypotonia of 6 mm Hg at 1 week follow-up visit. We stopped all her anti-glaucoma medication. Despite that, she had a choroidal detachment at 1 month follow-up visit. Even for her, we managed medically with the oral and topical steroids. No surgical drainage was required, and she regained her full pre-op vision at the end of the 1 month. The third complication, the patient who already sustained a blunt ocular trauma with closed globe injury underwent vitrectomy surgery and was left aphakic. Post-surgery, he had a high IOP spike, and it was not controlled by maximum medical treatment. So he went the laser procedure. Post-operatively, he developed vitreous hemorrhage at post-op day 1 and with a moderate control of IOP. So we could also see the Eifelman slit lamp, and vitreous hemorrhage was confirmed in B scan. There was also transient reduction in visual acuity for 55% of the patients initially, but later 80% of the patient regained their pre-op vision post-operatively in the late post-operative period. Finally, the cumulative success was found to be 83% at the end of the 6 months. So these are the various studies that showed different complications, but none of the studies have reported complications like vitritis, choroidal detachment, and vitreous hemorrhage, which were seen in our study. Concluding, Subliminal cyclophotocoagulation is a viable option for patients with mild to moderate glaucoma with maximum medical therapy. The major advantage of this laser was that it can reduce the burden for the instilling topical medications for glaucoma patients. In most of the studies, it was found to be safe, and however, few vision-threatening complications can occur, but these complications can be transient and treated with medical management. Thank you.
Thank you for that presentation. Could you identify any risk factors for those rare complications that occurred with your treatment?
None of the patients had any risk factors. Only the last patient who had traumatic aphakia, who had closed scope injury, we could have avoided this laser procedure for him. It actually led to vitreous hemorrhage.
Does the amount of energy delivered or the areas treated matter? Do you think so?
For every patient, we had the fixed amount of energy, that was 2000 milliwatt, and fixed duration is 160 seconds. So only the spots is also it's equal because it is superior continuous and inferior is also continuous.
Thank you.